Hello and welcome, everyone. My name is Renee Garrett, and I'm your speech therapy PD podcast host for Brainstorms, functional neuro rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for zero point 0.1 ASHA CEU. Here are the financial and non financial disclosures. Sydney Bassard is the owner of the listing SLP. She receives an honorarium from Speech Therapy PD for her participating as a podcast guest. She has no relevant non financial relationships to disclose. My financial disclosures are that I'm the owner and founder of BrainBridge Connect, and as the host of Brainstorms, Functional Neuro Rehab for SLPs, and other webinars on Speech Therapy PD, I receive financial compensation for both. I'm also an adjunct instructor at both James Madison University and Old Dominion University. My non-financial disclosure is that I'm the secretary for the Communication Disorders Foundation of Virginia. Questions can be written in the chat box or the Q&A and will be answered throughout the presentation. So now, without further ado, we welcome our guest, Sydney Bassard, MSP, CCC-SLP, who is a speech-language pathologist who specializes in working with individuals who are deaf and hard of hearing and literacy. She owns the Listening SLP, which is her private practice and social media brand. Sydney was noted as a distinguished early career professional in 2020 and an innovator in 2023 by the American Speech Language Hearing Association for her work centered on the equity of health information. Through her social media page, she engages with professionals and parents on the topics of hearing loss and literacy. Thank you so much for being with us, Sydney. Nice to see you.
Thank you so much for having me, Renee. I'm excited to be here tonight.
Yeah, same. It's been a Monday for sure. So hopefully everybody's doing well and congratulations. I know you have taken on a new role most recently in your personal life. I don't know if you had officially done the name change, so I didn't say anything about that, but
Yeah, it's been a whirlwind. So for people who are like, what are you talking about? Like I got married a little over a month ago. And no, I will professionally always be Sydney Bassard. So we're
gotcha.
we're good. Yeah.
All right. So let's jump right in. I love to start with talking about how people kind of connect to this niche area that they find themselves in. I know for me, working with adults with neurological disorders and progressive neurological disorders, it was a more personal thing for me. So can you talk to us about why literacy and why working with deaf and hard of hearing individuals was the thing that really just stuck with you?
Yeah, so I guess we'll go down like the literacy pathway first because I feel like that's the easiest one for me to talk about and make the connections with. So when I went to college originally was actually a pre-pharmacy major, and so I was gonna fast track it. I was gonna do 2 years undergrad, 4 years pharmacy school, and be done in 6 years. And that was a great idea until I didn't do well in an organic chemistry class and was like, you know what? I don't think this is for me. And around that same time, my brother got diagnosed with dyslexia and ADHD. And so my world kind of changed. Like seeing him kind of struggle and then seeing him also get intervention and help really inspired me. So I ended up working for a literacy intervention company for a couple of years in the summer to the point that I was able to like train staff in the program. They had like asked me to help step in and run like the satellite centers when need be. And so I like really become familiar with that. But I also knew that like I didn't want to be tied to working for a company. I liked literacy, but I didn't like the idea of not having autonomy in some sense. So that's when I applied to my master's program, and I was fortunate enough like we had a big emphasis on literacy within the program just because a lot of the professors were interested in it, and at the time like South Carolina had a law on the books that you had to, in order to receive like the degree, you had to have a certain amount of graduate hours in literacy.
Oh, wow. I don't think I realized that. I know there's been so many changes in the past few years about, it used to be a split between audiology hours for us in Virginia and adults versus peds and language and articulation. And I think a lot of that has kind of changed. So that's pretty interesting that you all had that because it's really needed, right? I mean, literacy is such a big part of what we do, whether we realize it or not. And so I'm kind of excited to dive into that with you. So, just as a broad topic, can you define literacy and just talk to us about what literacy is?
Yeah. So I mean, at like its core, literacy is just the ability to read and write. And it seems pretty simple. Most people are like, okay. But when we dig a little bit deeper, it really involves like, do you know how to understand and read words? So can you read words or what we call decoding them? Do you understand how to interpret and gain meaning from text, as well as being able to communicate that with other people? And so, like, that's what we think of when we're traditionally thinking of reading. And that tends to apply a little bit more, I would say, to like kids, right? When we're thinking of how do we teach kids how to read and to write. But I think the biggest shift for adults and things that we don't talk about when it comes to literacy is digital literacy, financial literacy, and then a big one with the adult population, which is health literacy.
Mm-hmm. Yes. Oh my gosh. And I know we talked about this before when we met, but so much of what I did in the hospital was thinking about that when redesigning educational materials, and then we went to this whole model of we had to use the company that designed the educational materials that the hospital contracted, and they were not for people who had any kind of visual loss, any kind of processing, whether it was auditory or visual. They were not set up for really anything less than a ninth grade reading level, which, I worked in a very rural setting for a long time, and that was not who my patients were. It's not the population. We also had a prison that was pretty close, like half a mile from our hospital. So we tended to get a lot of people that were in the justice system who, again, varying backgrounds. Maybe they didn't have good literacy skills to begin with. And then, they've been in the justice system now, and they're trying to navigate the health system without support and without advocates. And I think that's a whole other topic we could talk about for hours. But I think, thinking about those skills that we need, not only to read a passage, but to come up with a response too when we're reading that, to know what questions to ask to the medical providers or the people who are supposed to be there for support staff. That's a challenge.
Oh yeah, 100%. And it's often one that kind of gets glazed over. I mean, even think about like when we interact with healthcare professionals ourselves, and when you're thinking of somebody who is an SLP or any type of professional, like you've gotten to be where you are, you have master's degrees. So like when we look at the education levels within the US, like you're considered to be in a higher demographic than where most people are falling. And some of the stuff that we get, we're like, well, what does this mean? Or I'm not sure. Or even think about how, a lot of healthcare places now are using MyChart or some other type of EMR system to communicate with people about their results. I mean, I had this happen recently. Like my doctor communicated some results to me and said something looked low. And I had to go back and say, I'm not really sure what that means. Like, can you explain this to me more? And they're like, oh, like it's actually not a bad thing. Well, in any other context, if someone tells you like a number is low, you're going, oh, that's not a good thing. And they were like, no, no, that's actually really good. And so if I didn't have the wherewithal to even kind of push back and ask a few more questions, that could immediately have sent me into panic and put me in a tailspin. And when we think about, especially the people that we're working with, when you're really focusing on adults or people that have had some type of traumatic brain injury, cognitively, like they may not be at the same place that we're at, or they're already experiencing some level of difficulty, and now they're also having to navigate and advocate and figure these things out. That's a level of stress, especially if they don't have a good support system or people that are kind of in their corner to help them navigate some of those things.
Yeah, for sure. I know, again, thinking about the populations that I've served, it's been, I've been in 5 different hospitals just because I was resource pool when I first started for the acute care system. So each hospital had its own personality and its own demographic and its own. It sounds weird to say that, but if you've worked in a large health system where you're serving this varied community in different cities that are like I'm in Hampton Roads, so there's like 7 cities right here, but we're all very different as far as demographics, socioeconomic status, literacy, all those things. And so it really trickles down into the hospital and the patients that we're serving and trying to figure out, okay, what do I need to do differently to help this patient to be an advocate for them? Because, in a perfect world, everyone would come in with a strong either family system or advocacy system, and that's just not the case. Some people have it, a lot of people don't, and that really impacts their ability to not only process the information, but like you said, know the right questions to ask. I saw a lot of times that, especially in acute care, the providers are typically very busy. And even though they had a stroke education team, the stroke education team would come by and, it's acute care. The patients are often out for testing. Maybe they had surgery. Maybe they had something else going on and they're not in their room and they leave this booklet about their stroke. And that's their stroke education. And they might not even, we don't even know if they actually can read. Has anyone asked that question? Because it's much like if you've worked with swallowing patients that everyone says, yeah, I'm on a regular diet. Yeah, I eat whatever I want. But then when you dig deeper, you find out that that's not always the case. And I think with literacy, it's the same thing. So I know this isn't really about, partly about social determinants of health, but I think that's a big piece of it when we think about literacy, because that's something that a lot of people still continue to kind of miss. One, they don't really understand it. So therefore, if I don't understand it, I'm just going to pretend like it doesn't exist. And that's clinician wise, it's I think other provider wise. And for me, I feel like I've always had this kind of responsibility where I felt like I needed to speak up and I needed to be someone who says, hey, this just because we've always done it this way doesn't mean that's the right way to do it. Um,
Oh, 1,000%, a
yeah.
1,000%. And I mean, when you're starting to talk about social determinants of health, like my public health brain started firing because how many times do like we not go over those things as SLPs? Like that is, I mean, my program was housed within the Department of Public Health. Like it's in the School of Public Health. So like we did some classes on IPP and we like did a couple of those. But overall, most people aren't really taught about the social determinants of health. And we don't go over the breakdown and how we can't just group everybody together when we're even discussing and thinking of social determinants of health. Like it's really individual. Like, yes, we know particular communities or demographics might be exposed to things differently, and those can all contribute, but we have to look at it at the individual level. And for those that don't know, I used to live in the area that Renee is talking about. Like I lived on the other side of the water from Hampton, so I lived closer to Virginia Beach. And even my families that came from like North Carolina, Outer Banks area that made that hour and a half drive sometimes to see me, very different demographic than the people I was working with that directly lived within the Chesapeake area or even the people that were coming over from Virginia Beach. And so
Hmm.
you have to, I think, also be in tune with your community
Yeah.
and what your community needs are, how that shapes your practice, because things that you're going to talk about in one area in space might look very different depending on what your community values and the outlook and shaping of people. So,
Yeah. And I think that goes back to the different hospitals because I mean, it's remarkable to me how vastly different it was because where I landed was what then was the rural hospital out near the farmland, the smaller communities, people that had a lot of laborers in the area who may not have finished high school. They may not have even finished middle school. And so their needs were vastly different than when I worked out of Virginia Beach at a level two trauma center with people who had higher socioeconomic status in general. Just the margin of income is different. But then you also had a lot of tourists coming in from various areas. And, if you're a tourist, you're paying for somewhere to stay. So you're, again, you're in a different demographic than these people that have been farmers and laborers out in this rural area where I worked. So it was very eye-opening early on in my career to see that and to think about, okay, this stroke booklet in color is not going to work for this person who left school in fourth grade because he had to help his family make money to keep their farm going. right? It's
Yeah.
not the same thing. And I think that's a really important point because also we're looking at not only when we think about literacy, like you said, not just literacy in reading and writing, but literacy in who's paying the bills. That's a safety issue for a lot of people when they have gone to the hospital and had an illness, whether it was a stroke or something else. Maybe they're not safe to continue doing that. They don't have the cognitive skills or they just don't have the skill set anymore to be able to continue to do that. Maybe they don't have the skill set to be able to make the money to pay the bills. It's very nuanced, and I think it's hard for people to. It shouldn't be hard for people. That's the thing for me. Like it shouldn't be hard for people to get that and to grasp that. But I think a lot of people get in their status quo and they just do things the way they've always done it, and they're not looking at how layered things can truly be, right?
Yeah. Well, I think our society in general likes to live in black and white.
Mm-hmm.
It's either black or it's white. And the reality of life as a human is everything's actually gray. Like being a
Yeah.
human being is very messy. Like, if life was easy, then we'd all get to live like these very cookie cutter lives and everything would be like on the same trajectory for all people. But the reality is like, it's a messy situation to be human. There's ups, there's downs, there's different things that are going to impact your life and how your life interactions shape who you are as a person and how that presents when you're in crisis situations. And so, therefore, like we have to always remember that there is nuance there, that it's never going to be this streamlined path for people, even for people that present like it's going to be really easy, black and white, like we just got to do this. Something always throws that wrench in there, and then it's a little bit wonky. It's a little bit different. We have to make adaptations to make sure that we're meeting the needs of where people are. And so I think that's always too is acute care makes it difficult because it's more fast paced. But when you do have the time, finding out basic information from people. One thing that I try to ask people to avoid, like, can you read questions, is how do you like to receive information? You
Hmm.
know, it's a simple statement, but it lets us know, like, do you prefer written information? Do you prefer like audio information? Do you like a video? Do you like a combination of things? What would you prefer? And so that kind of like alleviates that some. Something that I've started doing recently too is collecting podcasts and putting them all in like a playlist on my Spotify or something on a related topic. And so that way, if I have somebody that I encounter who's like, I want some more information or I'd like to listen, then you can share these like podcasts that professionals have been on and have vetted for them. And it's a nice way to kind of like bridge that gap where even if it's not the person, but their family can learn more. And people listen to podcasts in their car, while they're working out, or however they tend to do it. But it's one additional tool that you can have in your belt beyond just paper.
Yeah, and I've been doing that with my students a lot is assigning them things, and it's usually a pretty simple assignment. It's like listen, and they have some guided reading questions, just because I think it's helpful for them to hear especially the graduate students. It's helpful for them to hear the information in a less academic way. When it's professionals that sound like they're having a cup of coffee together or going to dinner and we're talking about these issues that arise in our clinical practice every day. And it's more digestible, I think, for students. They listen to it and they're like, it not only sparks their imagination, but it also can reinforce what they've been learning, but they don't know how to necessarily implement what they've learned because they're still learning. And it's hard. It's hard, right? We learned so much in our graduate programs that gosh, I was talking to someone else about this earlier today and it was like, oh my gosh, grad school still gives me like, oh, it's been 15 years for me and I'm still like, ah. It was a challenge and there were things that got thrown at us every day that were new and novel. And that's kind of what it's like for patients when they've had this new medical diagnosis. Everything is new and novel. Nothing is the way that it was before. And there's all this grief and acceptance and mental health stuff that could be going on, but yet you're expecting them to be able to read and decipher and decode this complex information that maybe they wouldn't have been able to do even at the the time before they had their stroke or whatever their disease process might be that led them to the hospital or whatever facility to begin with. Did we talk about underlying skills yet?
No, we haven't.
Okay, that's what I was thinking. I think I got off on a side road.
It's all
Um,
good.
yeah, so talk to us about what the underlying skills necessary are to read a passage. And this is just, I think this is going to be the fascinating part for me too. No pressure. It's
Huh.
just, it's just
So,
interesting.
so I think one of the biggest ones that we underscore is like language. Like language is one of the biggest underpinnings for all literacy skills that we need to have. And so when someone has weakness with language, like they are going to struggle with reading comprehension. So I like to think of reading comprehension a little bit differently. Like sometimes you'll be like, oh, they struggle, they're struggling with reading comprehension. They don't understand. But the reality is like there's something else that's kind of going on before we have that breakdown. So the model that a lot of people talk about is what we call the simple view of reading. And so Goff and Tumner came out with this theoretical model in 1986. And it basically said that word recognition times language comprehension gets you to reading comprehension. And so it shows that it was like a multiplicative relationship, meaning that both things need to be equally strong in order to get you to that reading comprehension. If you have weakness in one area, your end product is not going to be as strong. So when I'm describing it to people, I often talk about like a key in a car model. So let's say like word recognition or being able to read the words is my key. And I have those in my hand, but I walk out to my language comprehension center, which is my car, and there's a flat tire, or the engine is dead, or the battery won't turn on. I can have the keys in my hand ready to go, but my vehicle to get me there is a dud right now. And so I'm not going anywhere fast. And the reverse is true. I can have my brand new, like my dream car used to be a Jeep Wrangler that was coral with like a black interior. So, like, you can have whatever kind of car you want sitting in that driveway. It's ready to go, no issues. Your language comprehension's off the charts, but like you forgot your keys inside. So you don't have good word recognition skills. Your car can be as beautiful as you want it to be. You're still not going to have the thing to turn it over to get it to go where it needs to be. And so that helps us to understand that, like, a lot of times when people are talking about reading, they're just like, well, can you read the words on the page? But really, do you have the language ability to unlock those things? And so kids have to be able, and adults too, have to be able to have good phonological awareness skills, the ability to read words, and then also the ability that's really important is to read words as if almost by sight, meaning that you're not sitting there with a word and you're not reading it letter by letter, sound by sound, having to sound everything out. You're able to look at a word quickly and figure out what it says and move on. And why that's important is because we need those skills to become automatic so that we can be more strategic with how we're using the language centers in our brain to unlock the meaning. And when you think about, especially medical terminology, right? The more that you have background knowledge on something, it's beneficial. The vocabulary, the sentence structures that are being used, all of those things come into play, and you use your knowledge of all of those in order to unlock a message. And unfortunately, medical terminology and medical like health information that we have in our country tends to trend on that higher end. It doesn't
Hmm.
tend to be what it should be, which is really like around, I try to make sure that things are around like a fourth, sixth grade level. Most unfortunately of our medical stuff that we have within the US tends to be really like ninth and above.
Yeah. Yeah. And I think I go back to this a lot with like discussions with in my own family of, I grew up in Virginia, and when I was learning to read, we had sight words and we learned phonetics. We learned how to sound out, decode words. But we had those basic sight words that we did, like, flashcards or however we did it. And then my husband grew up in Florida, and they did not do any kind of phonetics or phonics. And so for him, it was a deeper piece of it. So it's I think it's really interesting to see the difference, because a lot of people, I'm in a highly military area. A lot of people grow up in very different places and they didn't have the same reading comprehension or even language education that I did, and it made a difference.
Oh yeah, 1,000%. Like it definitely has an impact. And so I think that's why it's so important for us to just not assume that like people have the ability to read. Um, and like someone mentioned in the chat, yeah, language reading or like what we call balanced literacy is fading out in this country. There are some people who were not taught phonics and they struggle because of it, because of whole language or balanced literacy, which is 1,000% true. And I think even like for people that were taught phonics and different things like that, when you know what someone's language of origin, it also takes into play because there
Yeah.
are differences and like the brain understands and processes how to read the same. But the way that people like present when they're reading things aloud and how they comprehend or like words that we might have in English. If they're reading this, maybe they can fluently read in their language and understand. We don't necessarily have the same words. It's not always a one-to-one match, or how they talk about health information is different. And so all of those things kind of come into play as well.
Yeah, and I think we talk about that a lot, or at least there's a lot of chatter in our communities about, like in the SLP community, about assessments in particular, and how just because something is available in Spanish, for example, that doesn't mean it's a it's a translation. It doesn't mean it takes into account for things like dialect, or it's not necessarily normed on the Spanish speaking population. It's still normed on the same group of folks, but it's translated. So it's a bilingual assessment, but it's really not. And we know that. And I think there's a lot of people out there who are doing work to try to improve those things, but it's not where it needs to be right now.
Yeah. Yeah. So many different factors and things to consider when it comes to sharing information and thinking about how people interact with information too.
Yeah, and I know you primarily do a lot of work with pediatrics and with children, and a lot of the conversations that you have are that literacy focus for kids. But, this is still impactful for adults, and I think there's far more than kind of what we've already touched on as far as impacts on adults. So is it something that, you can kind of speak to in your practice and what you've seen?
Yeah, I mean, so yes, I love my littles, but I think even literacy, the way that it expands when you think big picture public health, there are a lot of things that we just don't cover. I mean, we cover like, you want to make sure that you're giving your patient something that's accurate, that they can read, blah, 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 and you send them out the door. And what do most people do with paper? It's crumbled up, it's thrown in the trash. There's not enough conversation around like sharing information and disseminating information that's going to be high value and impactful. Most people are
Mhm.
far more likely to look at a link to something or watch something later, like when they have the time to do it, versus you giving them a piece of paper and then it ends up in the garbage can. And then even for, especially for with adults, we have to think about digital literacy too, especially in the age and time we live in. I mean, while I work with kids, I also work with their families and their caregivers. And so sometimes like that involves having to break down what my EMR platform looks like. How do they engage? How do they interact with it? How can I tell them like how they can access their bills and add their card information and how they can review certain documents? And when we think about, especially with our adult population, the way in which we communicate now with our doctors is very different than how our parents used to do it. You weren't communicating with your doctor unless you went in for a visit, and you might be fortunate that your doctor would answer a phone call if you called. Now, most of the times, like, you only go when you have an appointment. But anything else you need, you send a message through a chat
Yeah.
system, and then they'll give you a response. And if there's a prescription, they'll run the whole visit through a back and forth chat. For a lot of our people that we're working with, they don't know how to navigate that or how to access that information or what that looks like. And so, like, there's even the digital literacy aspect that I feel like as the SLP, especially when you're supporting somebody who really like is post-stroke, post TBI and needs your assistance from that standpoint, like that is
Hmm.
part of what's in our scope. No, you don't have to break down the whole EMR, but hey, I want to make sure that you understand how you can appropriately access your health records. How do you ask these questions in these channels? I mean, you can work the goals that you have for them in with doing something like that. You're still targeting what you need to. You can still document it for insurance purposes, but it's also something functional that they can walk away from the session with versus going over worksheets and handouts.
Oh, ugh, the worst. Yeah, no, and I think like with the digital literacy part that you were talking about, we're also in this kind of generational divide of we're dealing a lot with in the adult world with baby boomers and, you know, people that are 60 to 90 over 100. And my father-in-law is 82. He has a cell phone, but if you text him sometimes he doesn't. Oh, I didn't see your text. Or he's not like on social media. My mother-in-law, when she was still living, she was like Facebook watching puppies and looking at recipes, that kind of thing. So their usage of it is varied too. And so for them to get messages from their physicians regarding things like prescriptions that may be important, right? It may be something that they need. It's a life-saving medication or a medication they need if they're diabetic or hypertensive or whatever the case may be, and they need to be on board with it. That's a big piece of it. But I know even in acute care with the stroke patients, a lot of times, this was a few years ago. This was definitely pre-pandemic. They had a video that the hospital had completed and they would just go and turn it on for the patients and expect them to watch it. And you go into the room, and what's the patient doing? They're taking a nap. They're
Exactly.
not watching any of that. So even if they tried to address the reading literacy or the reading comprehension in that way, it still wasn't effective because at that point they were acutely ill and they still weren't able to attend in the way that would have been meaningful or beneficial for them.
Yeah, it's definitely interesting. It was funny when you were talking about like older family members. I mean, my grandpa is like, he's up there. I think we're hitting 90 pretty soon, but like refuses to interact with technology.
Yeah,
Like, not
we
want to
see that a
text,
lot.
like does not want to interact with a cell phone. He has one, but like it's just kind of there. My entire wedding like process. I mean, we sent out formal invitations, but like you RSVP'd via like the website and I had to call and was like, "So what would you like?" Like refused. And so this is someone who refuses to do this for like personal reasons. Can we imagine when they're have to do this for medical reasons? And then think about how irate like it becomes a tense situation. Well, Mr. So and so or Mrs. So and so, we sent you a note, we sent you an email, we sent you a text, and they're like, I don't even do any of that. You know,
Yeah.
we do have people that they choose not to use technology. And so then even explaining to them, how to navigate the system, removing the technology is still something that we need to think about. And what does that look like within your system? What protocols and things are in place for the people who choose not to engage with technology? There's nothing that says that they have to.
Yeah.
Even
No,
though it's
there's
the
not.
end of the world, it's nothing that says that they have to engage.
Well, and think about even like our consumerism is adults. We get a text message from, or you go to a website. So say like I'll go to Sephora or something like that. I'm looking to buy makeup or whatever, and it'll say if you sign up for text messages, you get an extra 10% off or notifications. And I'm like, I don't need another. This is annoying. And like I'm older than you, but it's only annoying because I get enough text messages and I don't necessarily want that. So I can see in some regards where if they're not familiar with it, it's not been a part of their routine. It's sort of been, Dad, we bought you a cell phone for emergencies in case you're out and you need to call 911 or you fall and you need to call us or whatever. That makes total sense. But to be like on there and go, oh yeah, I want to get 10% off for getting a notification every 37 minutes for you to tell me that you have a new product. I don't care about your new product.
And then they don't know how to unsubscribe. I mean, like the list just goes on and on and on, and
It
it
does.
you're just sitting there going, I'm just trying my best. Just trying my
Yeah. So we do have another comment. Someone said, I find myself supporting students' reading skills, teaching phonics for middle schoolers who are struggling. Well, first of all, middle school, bless you. That's a whole age group of hormones and stuff and things. So bless
Yeah,
you
it
for that.
is. But that's not uncommon what, the person is saying, unfortunately, because of the lack of proper instruction that a lot of kids have received. We are seeing a lot of middle schoolers and high schoolers that need reading support. And so, like, what does that look like? Even for our adults that struggle, what does that look like? My mindset is always like we push functionality. And so, do we need to sit there and go through a whole bunch of, phonological awareness activities, which are really basic skills? Not necessarily. My goal is like, I want to get you to have a good understanding of the letter sound connection so that we can quickly start reading words because that's what's most impactful for people at that age. But it's definitely tough seeing some of these middle schoolers really struggle with reading at their age. I mean,
Mhm.
it's not easy. It's not easy because they're struggling. They see where the gap is getting wider and wider. And then, unfortunately, too, the pressure of what's expected of them just gets to be more significant. I try to
Yeah.
always think of like, at a certain point, we have to start thinking compensatory strategies and start thinking about like realistically, what can we teach them to help them to navigate within the world that they're going to exist.
Yeah. Well, I know there's a lot of things that are popping out now, literature wise, as far as evidence-based practice about this whole, they're calling it, I think what I read yesterday, which kind of made me sad, like super sad, was calling it the lost generation. And they're talking about the kids who were like pre-K four, kindergarten, first grade, second grade, who are having huge issues because they weren't in the classroom during the pandemic and they were basically learning to read virtually, or they didn't really even get the foundational skills that they get between 4 and 8 for reading and those like pre-skills and foundational skills and all that. And we're seeing this whole literature piece come out now of people writing papers and things like that. That like tears my heart to think that these students are struggling in that way. And we're not talking about students who have, a different style of learning or a difficulty with learning. We're talking about kids who are typically developing kids. And we're seeing that trickle down now of how that virtual learning space, even though we like to think that at least we had that, but now what's the impact?
Right.
Yeah, so a couple people said people are going to be using AI to write papers. I teach a technical writing and clinical observation class for undergrad, and I'm already seeing that. We had to do a whole AI policy because the whole point of technically writing is to help the students prepare for not necessarily just graduate school. I have a lot of undergrad students who go on into teaching, they go into nursing, they go into audiology, they go into other things, but they still need that technical writing ability. It's a writing intensive major or a writing intensive course for the university and the major, but there's benefits to them having it even if they choose not to go into the field of SLP or even the field of audiology. They might have some benefit from that, but yeah, that's been a thing.
Yeah, we're seeing that all over the place. Whereas like AI can be a beneficial thing.
Hmm.
Like not when we're necessarily learning the skill. Once you've already learned the skill, then you can leverage it differently than when you're trying to build it. And the other comment about there's so many success stories of older students learning phonics and learning to read. Yeah, I've worked with older students as well as adults doing some phonics based work, and there's definitely benefits to it. Just sometimes, especially with like when you are in the literacy space a lot of the conversations tend to get stuck at like the phonological awareness level. We'll make sure we're doing phonological awareness, which is great and it's a building block, but like how do we marry that quicker to the letters and the sounds so that way we can get them reading quicker versus doing more sound play. Sound play is important, word play is important, but when we're thinking of older students and adults, we got to start closing those gaps quicker. And we don't necessarily have to do and spend as much time in phonological awareness land. We got to spend more of our time in making sure that we can get them to read sooner than later.
Yeah. Yeah. And Olivia says, unfortunately, schools don't have time to dedicate it for older students. So it's higher SES student, yeah, who get
Yeah,
higher SES students who get tutoring outside of school.
yeah,
Yeah, and that's not really my space that I work in, but I saw that even when I was working with adults with intellectual disability and developmental disabilities who were in the system of Medicaid waivers. And some of them still live with biological families, and their biological families are you really see a wide spectrum across the board of people who are in group homes versus people who still live at their biological family's home, and they're very well taken care of, and they have a lot better access to additional services. And it's unfortunately for me how what I saw a lot of times in those families were really some, and this I'm just going to say exactly how I feel like it is. It was really embedded in systemic processes that were not set up for these students to necessarily have good success because their families wanted them to be normal. What is normal? That's so they put them through these things and have these extra things that maybe that's not meeting the student where they are, right? They're doing it but for their own. And I'm not saying everybody, but I saw it quite a bit in the higher socioeconomic status students because I had some that were like 17, 18, end of high school in the system, and they qualified for the Medicaid waiver, but yet at the same time, their parents were affluent, they had financial means, and they were using the system, which the system is set up to take care of the individual, and that's fine. But like it's almost like some of them wanted that person to be someone they were never going to be instead of
yeah,
embracing who they are and trying to meet them where they are at. And that was one of the biggest, I think for me, one of the biggest challenges. And like one of the reasons that I just said, I don't think I want to keep doing this is
yeah.
it got, like you said earlier, it just gets
I was
like
gonna say it wears
messy.
on you.
Yeah. And it gets messy because you're like, you can't, he's never going to be what you thought he was going to be or what you want him to be. He is who he is. And like, let's do that. Let's capitalize on the skill set that he has.
Yeah.
Let's maximize what he can do, not focus on what you wanted.
Yeah, and those are some tough conversations to have with parents. I think those are also times where, like, sometimes people didn't have tough conversations with them early on. And if
Mm-hmm.
they did, it was met with like a lot of resistance, or I'm gonna quit and I'm gonna go somewhere else. And no one was like, I have to sit down and level set with you. And those are tough, like that's not literacy related, but just in general, those are tough. And figuring out how to talk to people who need different things out of those conversations is also very tough and challenging. It's just, yeah, it gets to be real sticky situations all the way around.
Well, especially when too, you're not necessarily, sometimes we love to work in multidisciplinary teams, but sometimes in situations we're not able to do that. We're splintered out and we're kind of siloed out in these different spaces. And, there's been times when I contacted a primary care physician or nurse practitioner or whoever it was, and they never responded. Or you contact the school-based SLP and God bless them, they're busy and maybe they don't even have the capacity and the time and space to be able to get back with you. Some do, some don't. And so it just becomes this like vicious cycle of trying to figure out how we can help, but yet like we're not working together always in the way that we would hope we could because of the way workloads are, caseloads are. And it's the same in the health system with the way that the caseloads are. It's when I worked at our big hospital here, we covered the whole campus with 1.5 SLPs at one point, 6 buildings. You can't. I mean, you just can't. It's not even reasonable to expect that. And yeah, anyway, that's a whole different conversation. But kind of going back and thinking about, your work with the deaf and hard of hearing community, I think there's a lot of pieces with that. I know where I went to school, we had a cochlear implant preschool, which was really cool. But there's a lot of people in the deaf and hard of hearing community who don't want cochlear implants. They don't necessarily support that for their own self or even their family members. And I think thinking about accommodations for literacy for people who are deaf who have never heard spoken words, it's harder for them to be literate and to be able to understand how to read or be able to decode when they can't. Again, we go back to that phonetic awareness or phonemic awareness. They can't hear it. They've never, so say they're, 20 something, they've never heard it. It's really hard and challenging, I would imagine, for them to be able to read a passage.
So there's a literature out there that says a couple of different things. So I think traditionally, like for people who have followed more of the spoken language approach, we have seen where there's the discrepancy between our what we would consider like typical hearing or normal hearing range, and then people that have some type of hearing loss, a degree of hearing loss. But even people who have never like spoken or who primarily use ASL as their primary mode of communication, like they still are able to learn how to read through visual phonics and other types of programs like that. And so they are able to decode and understand for their different medical needs and purposes. I think that's where we get creative with how we share information, right? So like you can still share a video with a deaf person, just put closed captions on. So like no, they're not getting the sound impact of it, but like they can read the things that are on the screen. You can share the information that way. Drawing things out, having visuals are there. That's where we can rely on interpreters more. And so thinking beyond just like pencil, paper, read this, understand that. How are ways that we're going to disseminate information that are going to be highly impactful for them? Because regardless of like your hearing status, you still need care. You still need to understand what that looks like. And especially for SLPs, it's not our job to push. Most times by the time we're encountering adults that have hearing loss, most of them tend to be what we call postlingually deaf,
Yeah.
meaning that like they've lost their hearing loss due to, age, could be due to noise, a whole bunch of different factors, but it's come over time. It's not something that they lost like from birth for most people. And so they had some level of degree of hearing at some point in life. You can lean on that. I do always encourage people to educate folks on the benefits of hearing aids,
Mhm.
because there are benefits to hearing aids for people, especially like when they've been what we call a period of deafness for a long period of time where they've waited a really long time before they get any type of amplification. But encouraging them to like how it can improve their quality of life is important as well.
Yeah. And I think a lot of people, at least I mean, I've worked in assisted living, I've worked in, like I said, acute care and in IPR. And even like my own mother-in-law, she had hearing aids and her hearing aids weren't always effective, but she was a big fan of Beltone. So she'd go to Costco and go to Beltone and get her new set of hearing aids. She had the latest and greatest, and half the time they didn't do a darn thing for her because she didn't like going to the audiologist. So again, I think it just goes back to like preconceived notions, our own biases, things that have worked and things that have not worked for a lot of different reasons and a lot of different patients. And it's just it's hard to generalize. And I did a little generalization there about the deaf and hard of hearing community on purpose just to see what you would say. Because I think, again, a lot of people just really have this old school mindset of, and I remember thinking that that's what we were taught, especially in undergrad, was that if people had never heard the sound, then they wouldn't be able to read. And we know now that that's not always the case.
Yeah.
And we definitely see more representation with different celebrities who've spoken out. Marlee Matlin's an actress that has done a lot of speaking out about it. And I
Imelda
want to say
Marco has also,
that's,
and he
yeah,
was he was at ASH,
Asha. Yeah.
what, in 2023?
Yeah.
He was in
Boston.
Boston. Yeah.
Yeah. I saw him. I was at that ceremony and it was pretty powerful. He did not have a great experience with speech language pathologists as a younger person, and he was very vocal about it, but also very grateful, which was interesting because his experience wasn't so great, but he was still grateful for the opportunity to speak, but also the opportunity to say, I realize everyone is not the same. And so, I thought that was a pretty cool thing to say. My experience basically sucked, but thank you for the work that you're doing.
Yeah. Well, and I'm glad that he said that because I do think that there is a contingency of people who like want to villainize SLPs and make it seem like, all SLPs are bad or they don't believe in total communication or they don't want to support, like they don't want to support people's deaf identities. And I will say that we've seen a shift. We have seen a shift where people used to be, how do we get you into like mainstream as much as possible? Whereas now it tends to be more of like, okay, well, like what is going to be most beneficial for you? Like, could that be amplification and using sign, or are we going sign only, or what, And so I'm glad when we have people that can speak their authentic truth and say, like, this
Yeah.
was not a good experience for me. This is why it wasn't a good experience for me. But I'm glad that we can see a way and a path forward to make it a better assessment.
Yeah, because it's an opportunity for us to learn and grow too as clinicians, right? It's not, again, I was talking to someone earlier today, and one of the overarching things was it's not about us, really. It's not, it's about the patient and it's about the students that we serve, whether you're acting as a CF mentor, you're a externship mentor, or you are serving public schools or even some capacities private schools. We have this responsibility to make sure that we are taking ourselves out of the equation and making sure that we're patient focused and the care is centered on the person that we're supposed to be taking care of and helping, because that's really what it boils down to is we don't get into this profession for the money. Let's be honest. We love people, we're trying to help, we want to provide ways that can make patients' lives better. Ultimately, that's kind of the ultimate goal for us. And when you bring yourself to the table and you're like, oh, well, poor me, they didn't like what I did. That's just to me crappy practice. It's poor practice because it's not about you.
Somebody put something in the chat for your adult clients with
Yeah.
acquired neurogenic disorders. What literacy assessments, formal, informal, do you like to utilize? And I'd love to know your thoughts on this because my line of thoughts, especially for people who are like post stroke, is what are you trying to get the literacy assessment to tell you? I guess would be my question. Because you don't have a baseline of where they were at before this neurogenic event, and now the event has happened. So I could go through a whole literacy assessment panel, but is it really going to be worth my effort and time? Versus what I could do is something informal. Can
Hmm.
you like quickly tell me, what are the different letter sound associations that we have there? Okay, perfect. Have them maybe read a couple of sentences and tell you what they read. That's where I would pretty much lean to. And if you're seeing any gaping holes from there, then you could like work on that in intervention. But generally, with people who are post like neurogenic, acquired neurogenic disorder, literacy, like the reading part, depending on your setting, is probably not where we're spending most of our focus. We got a lot of other things to focus on.
Yeah, no, I agree. And especially like acute care, it would be more like I focus a lot on informal assessment. Can you write your name? Are you able to read something simple like the care coordinator is going to come in and say, this is your next level of care? Maybe they have to sign some sort of document for insurance. Do they understand what they're signing? That would be kind of more of an informal thing if I can be there when the case manager or care manager comes in to see where that patient is at, if they even can comprehend what it is they're about to sign, if they can sign their name. So it's
Yeah.
more in that setting, I think it's more about the immediate impact. In outpatient, it's different because by the time the patient gets to outpatient, they've had, sometimes I'd see an outpatient who was 6 to 8 months post stroke or post TBI, and they've either had a lot of therapy or they haven't. So I definitely would say I would have them try to read a passage. I would have like a writing sample of spelling to dictation, whether it's even like grapheme recognition. So we're starting with like, CAT for cat, and you just kind of break it down that way from graphemes to whole words to maybe like a short sentence, seeing if they can not only write from dictation, but also if I write it, can they tell me what I wrote? Can they recognize their own name? Can they recognize if they're, have a spouse or a child or a neighbor that's there with them? Can you recognize their name? That would be that's probably for me, that's the informal part that I would do in both settings. Because we have, for people with strokes who have aphasia on Western aphasia battery and things like that, there are components for reading comprehension and some writing tasks. But I think for me, the informal gives me more relevant information in the immediate part versus scoring something that I might not have time to complete the full assessment. I can only do a part of it. An outpatient, we were seeing patients for 40 minutes. 40 minutes isn't really, when you've got a patient with aphasia or a TBI with a cognitive deficit or even our dementia patients who need extra time. Extra time is like the one thing we train our communication partners on across the board. And if we don't have that extra time, we can't give the extra time. So it just again, it's a flaw in the system and something that needs to be fixed because it drives me nuts. Which is why
Yeah,
I'm kind of doing my own thing now because I can spend as much time as I need to.
right. Oh, good. I'm glad that we answered your question.
Yeah, me too. And just we got a couple of minutes left. If people have questions, please make sure you put them in the chat or the Q&A because I think we've kind of covered a wide variety of adults and pediatrics and school-based and different scenarios. But are there things that or any kind of case study or anything like that that you feel like we haven't covered that is really something we need to talk about for the last few minutes? That was also a question for you, Sydney.
Oh, no, no, I think we've, I was like, oh, let's see what questions fall in. No, I think we've covered a lot of different topics tonight, and I'm excited. I mean, these are like the nuanced conversations that I don't normally have. So
Mhm.
I'm excited. This was a lot of fun.
Oh, good. And we do have a question that popped up. Any studies on literacy among CI students?
Are you looking for research that's there?
Yeah, and I'm sorry, it's late here and I don't CI students. What is CI?
Cochlear implants.
Oh, gotcha. Just talked about
Yeah.
the Cochlear implant preschool, and here we are, not being smart anymore.
No, it's okay.
Um,
I'm right there with you because we're both East Coasters.
yeah,
But if you're looking for research on literacy among CI students, there's a lot of different things that are out there. You can always send me an email at hello@thelisteningslp.com and I can share like if you tell me more what you're looking for. Because there's a lot of stuff on phonological awareness, on vocabulary, on word reading ability. I did a paper that we got published on like the impact of just minimal hearing loss. So it just depends on what you're looking for, but there's a lot of different kind of stuff out there. So I'd be happy to point you in the right direction.
yeah, and I think even like the preschool stuff when and I didn't work I didn't even do like any kind of interning in the cochlear implant preschool, but Cheer is the organization here, and please don't ask me what it stands for. It's CHEAR.
Yep.
They were one of the people that were funding or partially funding the preschool. They have a lot of community resources and also the Scottish Rite. The Scottish Rite funds a lot of university child learning centers and preschools where a lot of students do things like hearing screenings and preschool language screenings. They also do a lot of community work. So it's Scottish Rite, RITE, and I'm sure, I don't know what their website is directly, but both of those places have access to community resources. And another really good one that I think a lot of people miss because they think it's only AAC, but it's more technology based. It's TTAC centers at universities. So it's technology and something else. And they do have a lot of things for AAC, but they also have a lot of things for a lot of technology, information, resources that are free, things that they will help you find, like library resources and things like that for those of you who are working in school-based settings. But even, I mean, I found it helpful in the adult world too to contact TTAC for just different things when it came to technology and even some literacy things that were it's not things that I encountered in my everyday practice, like things that were just like one-offs that I was like, oh my God, and I don't I don't know how to handle that. So those are some really good resources as well. But Cindy, thank you so much for hanging out with us and sticking with me through the lateness of the hour on the East Coast. Just really appreciate you being willing to come on and to talk about literacy from a very varied standpoint and give us a lot of good information. So again, thank you so much for being with us. I appreciate your time.
Oh, thank you so much for having me. This was a great conversation, and I am so glad that we got to have it. It was truly a pleasure.
Oh, great. I'm glad you enjoyed it and you're always welcome back. Thank you so much, Sydney, and we look forward to seeing you again.
Thanks. Bye.